Today I'm going to talk about kidney transplantation as a treatment for renal failure. Now, you've already heard about the types of kidney disease that can lead to the kidneys failing, and a bit about some of the treatment options that are available. I think it's important to state that kidney disease and kidney failure is a spectrum, and some patients will be very early in their disease, and not all kidney disease progresses, but a lot of the different types of kidney disease do progress, and certainly when the kidney function gets down to a level of about 20%, that's when we start thinking about the options of either transplantation or dialysis. I'm going to focus today on transplantation. Dialysis is a wonderful way to support patients who have renal failure, but certainly if they're candidates for transplant, transplant is a better option. People who undergo kidney transplantation, rather than staying on dialysis, on average live twice as long. Obviously, dialysis represents a lot of challenges in terms of lifestyle. Folks who are on dialysis usually have to spend 3 or 4 hours a day, usually 3 days a week, if they're getting hemodialysis. And it poses a lot of challenges in terms of remaining employed and family responsibilities, child care responsibilities. It's also, in terms of the healthcare system, it's a lot less expensive to support a kidney transplant versus maintaining someone on dialysis. On average, it costs about $20,000 a year to maintain a kidney transplant versus at least $60,000 a year for a patient on dialysis. Now, your nephrologist will tell you when they think that your kidney disease has reached a point where you should begin to start thinking about either dialysis or transplantation. I think it's very important to point out that patients who are candidates for transplants don't need to wait until they're on dialysis in order to get a transplant. Patients should start thinking about the transplant option before they are on dialysis, if that's a possibility. Now, some people have a very accelerated pace to their renal failure, and it's not really possible. But most people develop chronic renal failure over a fairly prolonged period of time. And again, I think it's important to ask questions of your nephrologist, because I think some patients are referred fairly late for consideration for transplantation, and there are some sort of old ideas that patients should go on dialysis before they are considered for a transplant. We don't really believe that. Now, there are essentially two options in terms of kidney transplantation. One is to receive a kidney from someone who's died, a deceased donor, and the other is live donor transplantation. There are some significant benefits to live donor transplantation. First of all, if you're fortunate enough to have a live donor, you can receive a kidney before you require dialysis. And we know that if you are transplanted prior to dialysis, the likelihood of having a good outcome is increased. Kidneys from live donors tend to perform better, both in the short term and long term. They tend to work right away, and on average they last about twice as long as a kidney from a deceased donor. And as I stated, you can receive the kidney as soon as your donor has been worked up and accepted as a donor, and you've been worked up and accepted as a recipient. And that that process generally takes about 2 or 3 months. If you don't have a live donor, the average waiting time for a kidney now is somewhere between 3 and 6 years. So frequently patients do end up on dialysis before they receive a kidney, just because of the prolonged waiting time for a deceased donor transplant.
iCompassion.org, a registered 501c3 nonprofit, is the first free, independent, and trusted online community for people dealing with kidney disease. iCompassion.org allows people to quickly find information regarding kidney disease and treatment options, and to become a part of an online community to get connected, get better, share hope, and give back. Join today and share your story of hope.